that people who are unable to attend during this time can attend later on. So a little bit about the UAB Sparkman Center for Global Health. So we are housed in the School of Public Health, as you all know. Right now we are meeting in room 510, and our office is actually right down the hall in 517 if you're ever looking for us. So our vision in the Sparkman Center is to make substantive and sustainable contributions to the achievement of health equity and social justice in resource-limited settings around the globe by working collaboratively to increase public health knowledge and capacity. We do this by our three pillars of our foundation, which are education, research, and global health practice and community engagement. Our internships kind of fall into a little bit of all three of these. So a little education, little practice, and then in some cases, some research. And I just realized that I did not introduce myself. I'm Cameron. I know you guys know me because I've emailed you a bunch. But I'm the program coordinator in Spartan Center. So just hello. So our internship sites for 2022. So 2022 was actually the first summer that our students got to travel abroad again, which is super exciting. We had 8 interns over 4 sites. So we had interns at Koç University in Istanbul, Turkey, interns in Zambia at the Center for Infectious Disease Research, interns in Uganda at the Sunrise Center, and then interns at the National Conservancy in Masai Mara, Kenya. So I have a little page for each of you. So if you are here, you can just introduce yourself. You don't have to really talk about what you did. You can just say where you're from, what you're studying, that sort of thing. Okay. So Rishika, you are first because you're first.
Okay, my name is Rishika and I'm from Tennessee and I'm doing the Accelerated Bachelor's Master's program. And I went to Uganda this summer, and so we got to work in like a clinic and at school. So it was really cool, and it's really cool outreach. So I really appreciate the opportunity.
Yeah. And then Riti is not here. She is an MPH student in health behavior. And she was also in Uganda. She is originally from Indonesia. And so she is interested in women's rights, like community development. And she worked in Uganda on menstrual health and hygiene education programs. Next, Ami, if you want to take it away.
Yeah, so my name is Ami. I'm also an accelerated bachelor's master's student. My concentration is actually public policy. I got to spend the beginning of my summer in Kenya with Allison, and it was a lot of fun. We got to do a lot of different things and figure out how to run the organization a little bit better and add some more programs to what they were already working on.
Nice. And then Allison, she is a health policy organization student, and she's also in the Global Health Certificate. She was in Kenya this summer from, I think, May to August. And so she helped similar to what Ami did. And then she worked on their like internal and external communication at National Eye. For those that don't know, National Eye is kind of a, I won't say a big tourist attraction, but they do get a lot of their income from tourists. And so they really struggled during the pandemic income wise. And so Allison kind of stayed and helped them revamp some of their communication and stuff to maybe get a little bit more attraction that way. All right, next, and Kate.
Hi everyone, I'm Emma Kate Sellers and I'm doing my MPH in Health Policy and Organization and also the Global Health Certificate. And I went to Istanbul, Turkey this summer, and our community partner was Koç University. And on the screen is a little bit about the qualitative research project that we did.
And then Emma Kate was also with Sebastian in Turkey. He is an EPI student. He's ABM?
Yeah, he's doing immunology.
Okay, yeah, immunology. He's also one of our fellows this year. So he's working on research in infectious disease. And Emma Kate and Sebastian worked in Turkey with our Spartan director, Dr. Janet Turan. She's actually based in Turkey since 2020. So they worked there with her on some of the research, and her husband is there as well. He's also a UAB faculty. All right, and then Brenna and Shinaza, they're not here yet, but they worked at Centers for Infectious Disease Research in Zambia, CIDRS as it's colloquially known. But they worked on different analysis and data management for an ongoing study there in adolescent peer like support. So they could talk more about that when they get here. Okay, so reflection and discussion. This is kind of a time I just want to like open the floor for questions from students that are here or any. I see Anna's on the call and Katie, other of our Sparkman team members. They're kind of monitoring the chat. So anyone here who wants to ask questions, I have some questions for you guys. Hi, come on in. How are you? Sorry. No, you're totally fine. Please make yourself comfortable, and there's food if you want to grab anything. We were just getting started on the reflection, so you're totally good. So yeah, I have some questions for you guys. And then of course, if any of the students have questions, I know you guys were kind of chit-chatting before we started, but if anything left. Okay, so first question is, why did you apply to do a Spartan internship? And any of you can answer. Any of you three.
I think I applied because
You have to speak up a little.
okay, so I applied because in a lot of our classes we talk about public health foundations and core values, but it's so different when you're actually on the ground working. And I had the opportunity to work a lot in UAB organizations, hospitals, and clinics that also did a lot of public health work and community work. But I think it's very different when you're going abroad. You're working with a very different health system. You're working with a very different population that might not even speak the same language or have the same core values as you. And so it's a lot of merging what you learn in class into real life application. And then I think it's also a lot of problem solving that I really wanted to do, because I think whenever we have things in our lectures and PowerPoints, it's like clean cut bullet points, like this is what you do, a list of actions. But when you're actually on the ground and you're talking to people, you realize like there's a lot of barriers that you actually have to work through and a lot of people you have to talk to. And so that was something that I just wanted to do in person.
Yeah.
I just wanted more experience with like global health specifically, which is why I got my MPH in the first, or why I'm getting my MPH in the first place. And so just being able to like practice like global health like right there was like a really cool opportunity and like something I wanted to do. Yeah, along with just being able to apply to things we learned in the classroom, like in person.
I would say that I applied also. I can
Yeah,
everyone here a little bit. Because I mean, I always knew that I wanted to study abroad, and I was unable to as an undergrad due to COVID. And so this was a really good opportunity. Obviously, it wasn't for an extended period of time, but it was a really good taste of doing research abroad. And that's something that I want to do. And I'm applying for fellowships that are global health research related and where I would be living abroad for a year. So it was really good to get a taste of that for 2 months to see if it's something that I would like to do. And definitely it is something that I would like to do. So.
And like you guys said, I feel like when I was a student, it was like you learn all these things, but you never really know, like, can I actually do this? Or do I have the skills to like really be a practicing global health professional? So yeah, it is nice to know that you can go out in the field and use what you've learned. Okay, so kind of touching on a little bit of that, how do you feel like this has helped you professionally, personally, academically, all of the above? Just like, how do you think it enhanced your experience at UAB? If it didn't, you can say that too.
I think for me as a pre-medicine student, like I wanted to make sure that I had opportunities to work directly with the community. So I think doing this really, really exposed me to other issues abroad that people face, and gave me a new type of perspective that I don't know if I would have actually gained here. I think I would have, working with different populations, but it was something very different being over there.
Yeah.
Like Ami said, like just being able to like feel like be like in the community, getting to talk to like people who had completely different lives than you. Because like as a child of an immigrant, like you go to these places, but you don't interact with people in this like vicinity. So being able to do that was very, very interesting. And I also want to work in global health like in the future. So professionally, this like gave me like a really solid foundation and also like let me like believe in myself, like, oh, I can actually like go abroad. I could like make changes and like help people and like, yeah.
I feel like I already talked about how it helped me professionally a bit because I want to work in global health research and I want to live abroad. So that was a really good opportunity. And as you said, it just gave me more confidence and like, prove to myself that I could actually do it. And personally, it was just really fun also
That's always good.
to live in a different city for the summer, and made friends who were locals there so that they could show me around because I don't speak any Turkish. So that was kind of a barrier. But yeah, really fun and challenging with the language barrier.
Yeah. Going off of that, what do you think your high point or maybe your low or like your biggest challenge was while you were abroad, and your biggest best thing?
My biggest challenge was probably that I have a chronic illness. So just like preparing to go abroad ahead of time is a bit involved for me, like getting enough medicine and making sure that I'm good and ready to go. And then other than that, I also did get COVID while I was there. So that put a little bit of a setback in the research because it just delayed everything a bit. And I think other people might have also gotten COVID, which is why they're smiling. But yeah, those would be the biggest challenges. And then biggest rewards was probably just conducting my first interview because I was finally able to apply the qualitative research skills that I've learned during my MPH. And then also we did an intensive training once we were over there with Dr. Turan, because that's sort of her specialty. So that was really cool, just finally being able to have the confidence to do the first interview. And now I've done 14 interviews. So
That's really cool. Yeah. Go ahead.
What was the quarantine time for?
over there, it was 7 days.
Something to I'll add to that. I know whenever I went abroad, my parents were really worried about, things like that. Like COVID wasn't a thing yet, but just safety and things like that. But when you really think about it, anything can also happen here. You can get COVID here, obviously. A lot of people have. There's safety concerns in Birmingham. And so it's really just like being aware. You said like making friends in your community like you do here.
I felt safer there, honestly, most of the time than I do here, just because it's a really crowded city. So there's always people around. Like it's never creepy and like, walking alone on a dark street at night, like that never happened because there's just so much hustle and bustle, I would say.
Yeah. And just like, being aware of your surroundings and the culture that you're in at all times, which I think all of you did a really great job at, and obviously adapting to things if it wasn't exactly what you planned. So yeah. I'll turn to you guys. So same question, just maybe the best part of your experience or anything you want to share.
I think one of the biggest challenges for me was like kind of getting out of my mindset of like, I don't know, I view things like in a very American way. And so kind of like getting out of that, like I remember one of the first things we were like teaching like sex education to like kids who were like in this way, like 6th or 7th grade. And I was like, why are we doing like the way we were teaching it? Like they like apparently were already like sexually active and stuff like that. So like in my head, I was like, what is going on?
Yeah.
But I had to kind of get out of that mindset and like understand like this is like how they've been living the past couple of years. This is just what's been happening there. So
Yeah.
I don't know, just kind of adapting my mindset.
Yeah. Which is
really big thing.
Strange because I know like I went to a public school in Alabama. We didn't even have sex education.
No, literally. It's only
exactly.
So it's
and
like
so,
very different to see like comprehensive.
And that was
education.
in high school too. So thinking about like 6th and 7th graders.
Yeah, it was just very different also because like their AIDS and HIV is like very prevalent. So like it's very important for them to have like comprehensive education.
Right,
So,
absolutely. Yeah.
For me, it's the same as Kate. So I also got COVID when I was in Kenya, but honestly, I think it was kind of a plus because I'm obviously getting COVID, it's not okay. But I think I had the opportunity to literally go to a hospital and talk to public health professionals there. So when I felt like I was getting COVID symptoms, I made sure that I went and got tested at the like local clinic that was like an hour away. But it was cool because one, no one thought that I was positive because they were like, there's no such thing. And I was like, that's interesting to see that that's that perception of COVID, one. And then when it came back positive, the surprise on the doctors' faces like no other. But then like the doctor came out, and then the public health professional came out, and then like 3 other public health professionals came out, and like everyone was reassuring me, and I was like, I'm okay. It's gonna be great. And I was like wearing my UAB School of Public Health shirt too, and they were like, public health. Okay. And they were so excited. But it was cool to see their protocols and like what we do here in the United States if someone gets COVID as well, like learning the health department, things like that. And then seeing those parallels, but then also seeing what was different. So it was a plus, but yeah, that did happen. I would say that my biggest memory, I think that's like
Ami, before you continue, you know, we could have arranged a visit to a clinic, like to the students, future students. You don't have to get a COVID to be able to
No, for next year.
like you can skip that step.
Very true, but yeah, I can't believe that even happened, but it was great. I think a really big plus was when Allison and I got to actually meet up with a tribe that had come from like further up north in Kenya. They were also Maasai, but they were just from a different area, and so they came to Nashulai, and Allison and I got to lead a whole session to teach them how to use like social media and websites and to basically share their story online so that they could get more fundraising and donations. And I think that was really cool. We had a translator who was also there. So like we'd say a sentence and then she'd say a sentence to translate to the group, and then like you'd see everyone's heads down. It was pretty cool to let them know that their story really is that impactful, and everyone around the world does want to hear about their life and the things that they believe in and their core values, and that there's a way to share your story across the whole world.
Yeah, that is really cool. That's a good spin on your COVID situation. And I think it is interesting to see how healthcare works in other countries too. And it's funny that you say that, because I know a lot of people who like have been abroad in like European countries where there's free healthcare, or and they're like, you know, I'm glad it happened here and not the United States, but either way, it's not ideal. But like you said, it is a good learning curve. Okay, and then oh yeah,
We don't have to move it back and forth.
we're doing a little move in here. Okay, so last thing I had was just any advice you have for someone who'd be interested in doing a Sparkman internship. So that would be like advice you have in planning or coming back, like anything like that. Thanks for letting me know.
Please don't.
Yeah, sorry, it's me. I just need to switch to a different device.
Okay, you're good.
I'm causing trouble today.
I think my biggest advice is
Okay, thanks.
Be flexible, yeah.
It's really hard to gauge how things are going to work, where you're going to stay, how you're going to get from place to place. But if you stay really flexible, work with your like assigned people over there, work with your partner, then things end up working out. And also sometimes things are an opportunity and you never know that it might be. So I know Allison did this. I still had COVID when this was happening, but the women in the Maasai tribe taught us how to make like jewelry when beading, because that's a really big part of their culture. So then Allison actually took it upon herself to go to one of the like homes of the women who taught us in the first place. And she learned from there how to like do even more intricate design. So like kind of immerse yourself and make opportunities for yourself, because sometimes you just have to like work your way in and make sure that the community sees that you're not a threat and that you really want to learn about their culture and not judge it.
Yeah, that's a good point.
Yeah, I would just say to stay calm. Like there's a lot of things, it'll be very overwhelming. There'll be like rooms where like no one else is speaking English, or like you'll talk and like they just don't understand what you're saying. And like that can be very overwhelming, but like just stay calm. You're there for like the reason of education and learning and like just bettering yourself. So it'll be good at the end.
I would say the same thing about being flexible. So, and I think we've all learned that through COVID, but like when the war broke out in Ukraine, we didn't know if it might affect Turkey, because Ukraine is very close to Turkey, but it actually hasn't affected Turkey really at all. And there haven't been any Ukrainian refugees to enter Turkey. But at first we were like, I don't know if we're even gonna be able to go. And so, but luckily we were able to, obviously. And then getting there was a national holiday that lasted 10 days, even though it was only originally supposed to last 5 days. So that also delayed the research a bit, but we just found things to do during that time. And we got to have time for sightseeing and stuff, which was cool also, but definitely staying flexible. And with the application portion is just, apply. Even if you don't think that you're qualified, you probably are. And that you should just apply for any opportunities like this that you see.
Yeah, that's a good point. Something that I struggled with personally after I did my time abroad, like you guys did, was coming back, like re-entry. How do you feel about like the culture shock of the new country versus coming back? Have you guys experienced anything similar that you want to share, or was it harder, you feel like, to get back to the United States? I guess my question is, or harder to go beginning?
I think it was harder to go back to work.
Yeah.
Like we were definitely doing work when we were in Kenya. Like we had somewhere to go from this time to this time to actually be doing work. But I don't know, coming back to the United States and then like having like a to-do list of things to get done and to like try to go back into doing like all of the hard work that we had to do before when school was going on was just a very big transition, I feel like.
Yeah.
Because I felt like when we were in Kenya, everything was very like calm and like things will happen when they happen, and it's okay for us to take breaks. It's very like different view on productivity. And so coming here was it was a lot.
Do you feel like you've taken that into like your daily life now, or you're back into like the American like scheduling everything to the minute?
I think I'm back into the American scheduling for a minute, but the Kenyan way of doing it is still in my head.
Yeah.
Each time is like way more low key.
Yeah.
For sure.
Yeah. Even in Uganda, everything is very low key. Like the clinic opens at 10, it doesn't open until like 11:30.
Yeah.
Like things just happen on like the clock of like how they want it to, unless like it's super urgent or anything like that.
Yeah.
So like that was just really crazy. And also I came back and like I did do my secondary application.
Yeah.
So like literally I went from like making an impact to like typing for like 24 hours of the day. So that was a big job.
Yeah.
I also missed the fruit.
That
was
with the pineapples.
the pineapples and mangoes. Like I've had fruit back here and I'm just like I can't even
It's
eat
just
it
not the
anymore.
same.
It's true. The food is probably one of the things that I miss the most about Turkey. And every morning, pretty much when I was there, I would eat labna, olives, and pita for breakfast because that's what a lot of people there eat. And my roommates made it for me one morning. Like Turkish people are very hospitable and they want to feed you. And that's good because I like to eat. So so I had that for breakfast one morning and I was like, oh my gosh, this is life changing. I'm having this for breakfast every day while I'm here. So that's what I did. And then when I got home, I really missed it. And so I actually went to the Mediterranean market here in Birmingham and bought myself labna, pita, and good olives because a lot of olives here are not good. Now I'm an olive snob. I didn't even like olives before I went to Turkey, and now I really like them. But also arriving there was a bit of a shock. I mean, you get off of a long plane ride and you're just exhausted. And then I got to the airport and thought, that people would speak English, and they didn't really. My taxi driver didn't speak any English, and it was an hour-long drive from the airport to where we were staying, and I was completely alone. Sebastian and Abraham were already there, and then Dr. Tron was there, so I was just texting them. I was like, I think I'm going the right way, but it's hard to say. Like I'm just trusting this taxi driver with my life right now. So
yeah. That was a big thing in Uganda. There's no addresses. It's like down the road 2 like miles, and like they'll say it's so close, and it's like a 30-minute walk.
Yeah. I had the same problem. The house I was in South Africa didn't have an address.
Yeah.
It just was called like Mac House. Like it had a name. And so when you tell people like where you are, you just like save and it's just weird. Yeah. And I'm like, I don't know how to tell you anything other than that.
Like there's not like, what's it called? Like zip codes.
Yeah. That's funny. Okay, I will open it if anybody else has any other questions or if you guys have anything else to add. You really covered a lot, so I appreciate that. Give everyone a minute.
Hey guys, good to see you. Hi. Baby started crying in the background, but he's fine. I was wondering if you could talk a little bit about the work that you did and how you felt like it compared to what you thought you might be doing, or what was really what was different from what you learned in class? Because you guys talked about, you know, applying that, but what was an example?
I think my initial assumption when we got there was that the work would be very much so like program based. Like we get a list or we learn more about the exact programs that they're working on and figure out how to better evaluate them or figure out how to more expand them. But what it actually was when we got there was a lot of organization work, which I think was still cool, but it was a lot of problem solving in terms of like the National Eye Conservancy works with a college, or like they have their own college, and all of the whole college has a few teachers, 5 teachers or so, on top of the people who would work all of the programs, but there'd be like a single laptop that they'd be sharing amongst like 15 people. So then it was trying to figure out, well, okay, how do we organize the programs that we currently have, given that we only have one computer that's being shared amongst so many people, because like having a virtual document might not be as useful because not many people are going to be able to see it. People might not even know how to work the single laptop that's there. So then figuring out how to organize that, and then also organize how to get every single one of those people on the same page in terms of how we need to run the programs or the curriculum for the college. And so I think we ended up doing a lot of like the back end work with how to manage the organization, which was definitely needed, but was different than what I assumed we'd be doing.
Yeah, that makes sense.
Yeah, I also thought I'd be doing a lot more like program like based work, but instead it was a lot more like counseling based and like community, like we would literally like go talk to people and like just like hear their stories and stuff like that. So it was very impactful, but it like just was not what I thought I'd be doing. Like at certain points it was like very less like public health and more just like community improvement, which like obviously is very important within public health. It was just like the health part was a little bit removed at points, which was really interesting. And then also there were like barriers to communications at a lot of times, which like I wasn't really expecting, because like we would go to school and they speak English, but then like I would talk and like they weren't like hearing what I was saying,
Right.
because there was like an accent barrier or something like that. So it was just interesting sometimes, like just things you wouldn't expect like popped up. But
I would say that I pretty much knew what I was getting into because Sebastian and I did design the interview guide and consent form and everything that went along with the study that we were working on with Dr. Tron. So in terms of what we actually ended up doing, I was expecting that, but I don't think that there's any way to like train anybody on qualitative research without just like pushing them into it and just doing it, especially with key informant interviews or running a focus group or something like that. I learned about it in class multiple times, but I was still so nervous to actually get started. And I remember telling Dr. Garten like that I was worried about my first interview. She's like, MK, you can't break the interview guide. Like it's not going to break if you just, you know, because I was trying to decide the balance between how many questions I'm going to ask or like how many follow-up questions. And you can't learn it unless you actually do it. So yeah, that was a big jump for me, I guess, just doing it.
Okay, thank you. She has to go to class. Okay, anything else? You guys are killing it on your answers, by the way. You're all very, very well done.
Thank you.
Okay, so I'm just gonna move on then. If anybody has any other questions, please just feel free at any time to talk or pop it in the chat. So talking about applying for 2023. So how do we get started? So first off, learning more about our program. So attending a session like you are doing now, and then analyzing how the internship will fit into your curriculum. Internships can be completed for course credit, internship credit, or just for professional experience. And then the application will be on our website. It's essay style questions, and you will also upload your resume, your transcript, and then enter your site placement preference. So application timeline, so early fall, which we are in now. You will determine your eligibility and then learn about the program and how it will benefit you. So UAB juniors or seniors who have a GPA of at least 3.25, graduate students and doctoral students in good academic standing are all eligible for our internships. Domestic and international students can apply. That's an important note. Late fall of 2022, you'll complete the online application, and also internship site placements will be announced. We're working on those right now, but we just want to make sure we have everything in place before we announce to students. We don't want to have to backtrack on anything. So we're working on those now. December 2022, interns will be announced. So you'll know before the spring semester starts if you are an intern and where you'll be going. And then in the spring, you will work with the Sparkman Center to receive all the necessary approvals, funding, purchasing your plane tickets, finalizing all your other arrangements, and then completing our Canvas course online. This is online training and it covers topics country specific, so global health practice, safety, ethics, that sort of stuff, just general 101, how to travel abroad. And then in summer of 2023, you will actually travel May to August. You might have heard some of our interns talk about their time. So timing is different. I know Emma Kate, you went in.
I started June 16th and was there until August 10th.
So she went June to August. Allison, I know, went May to August. So she was there basically all summer. So it kind of just depends on what works with your schedule. And then fall 2023, when you return, you'll complete all your internship write-ups, your poster, and then continue working with Sparkman. So things like this, where you're lucky to have our interns to share the Global Health Certificate, Fellows Program, all those good things. So just a few important notes to talk about. So GPA 3.25, like we mentioned. Internships are supported with a $3,000 stipend if they are in person. So if you travel for your internship, which fingers crossed, we will continue to have in-person experiences, you'll receive a $3,000 stipend from Sparkman to cover those costs. Students can also apply for outside funding. So need-based scholarships, Education Abroad has a ton of funding for students. You got a scholarship from Education Abroad. That was Emma Kate. She said she got a scholarship. So, and you can apply for as many outside funding sources as you want or as you need. Another important note, students are in charge of organizing their own travel to and from their country. So our internships are a little bit more independent. We will help you obviously in any way that we can, but in the end, you are in charge of making sure you get to your country and obviously get back home. Program length can vary. So like we mentioned, Emma Kate said she went the later half of the summer. We had other interns. Ami went early May, and then Allison stayed most of the summer. So kind of just depending on what works for you. But we do suggest going 1 to 2 months for a more immersive experience. And then lastly, this experience does meet the internship requirement for an MPH degree. So if you are an MPH student, you do need that to graduate, and you can use one of our internships to do so. And then this slide is just a little bit more about funding opportunities through Sparkman. So we talked about our internships. We also have different funding, and I just kind of want to run through these. If you have any questions, please feel free. You can always email us about something specific or come by our office. But we have, so you can kind of see these comparatively in this chart. So global health internships, like we discussed, Moses Sincala travel scholarships. So these are more research-based. Students will pick the location and the travel date based on their research topic. Again, there's a stipend involved, and then they're open to any UAB student completing international internship or research opportunity. So unlike our internships, these are not, the location is not determined by Sparkman. It would be up to the student based on their research that they're doing. Then we have SOPH travel awards. These kind of fall into two different categories. So this is funding just for students in the School of Public Health. It's supported by our office and the Dean's office. So it's just for SOPH undergrad, graduate, and doctoral students. this is funding for students who are traveling internationally, attending a conference, a training, an internship, that sort of thing. And then for faculty-led programs as well. So we do have the, the faculty-led program that runs out of the School of Public Health. This year they went to the UK, and we funded a few students who went on that faculty-led course. So these are, the SOPH travel award is up to $2,000, and then the faculty-led is more dependent on the cost of the program, the length of the program, that sort of thing. And lastly, we have conference and seminar funding. So this is to support student travel to participate in a global health conference. Again, the amount varies on the conference and the location, length of stay. And this is can be given to anyone. So any student at UAB can apply, and priority is given to students who have accepted abstracts at the conference. So if you are going to actually present there, we have priority for you to get the funding. So any questions, comments, concerns? I know that was a lot of information, but just lastly, how you can stay connected to us. So obviously follow us on social media. We are at Sparkman Center on Facebook, Instagram, and Twitter. You can subscribe to our newsletter, which goes out monthly. That is where we'll announce fall events, internship placements for 2023, and all other big announcements. You can also attend our events and seminars like today's event, apply for internships and travel awards, or stop by our office anytime. We are in Riles 517. There's a question in the chat. Do we know the site placements for summer 2023? So not yet. Like I mentioned, we are just working on the final logistics of those. We want to make sure we have everything in place with UAB and with the international partners before we announce anything, just so we don't have to retract anything. But we should probably, or we will have those announced probably, I would say next month, maybe October, November. So you will know ahead of time before applications open where the sites are for 2023.
Yeah. So unfortunately, we are still kind of post. Yeah. We are still. Can you hear me?
Yeah, you're good. Oh, she's gone. I can hear her, and then she left. I think she was probably going to say we're still a little bit post-COVID, meaning that, like, I know this past summer it was kind of hard for you guys because we didn't know if you were going to be able to go in person or not until pretty close to call.
Until literally April.
Yeah, it was hard to know like what was going to be in person, and so that kind of affects the placements because some places are obviously easier to have a remote setup with than others. So yeah, we are still kind of living in a, well, not kind of, we are in a post-COVID world. So here she's back, so we'll see what she has to say. Hey, Anna, can you hear me? I'm not sure she can.
Can you hear me now?
Yeah,
Sorry,
yeah, you're good.
Yeah, I was just saying that unfortunately the approval process still takes longer, even though we are kind of post-COVID. I know not completely, as we heard from our interns as well. But the approvals still take much longer to get approved, not only for safety concerns. This committee is also assessing the COVID situation. So we expect delays this year still to be in place. So, but, on the flip side, it's good that they are verifying locations. UAB and us will not send you to a place that I would not send my, that I would not send my kids. So if I wouldn't feel okay to send my own kids, I will not send you either. And UAB is also taking that position. But unfortunately, it also means that the approvals for the locations take a little bit longer to put in place.
Better safe than sorry, though. Okay, if anyone else has any other questions, please feel free. But if not, I will give you back 15 minutes of your day. We did record this, so if you would like to go back and look at any of the information, it will be on our YouTube page. And again, if you have any questions, please feel free to email or come see us. And thank you guys so much for joining and giving me part of your afternoon. I appreciate it.